Hey guys, Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we've got heaps more content coming out and it's really fun and great and we love it all. Also very good. Hey guys, welcome back to another episode of the AltMed podcast. I'm your host, Andrew Dowling. I've got another co-host with me as always, Mitch Kurtz. How are we doing, Mitch?
Yeah, good, thanks.
Pretty excited about this one. We've got a return guest that's come back to tag on to the discussion, but we're here tonight to chat with Ben Smith-Wade from Grove Clinics, the product manager there, and a special appearance by former guest Dolly Shukla. Dolly and Ben, welcome to the show.
Thank you. Great to be
Ben,
here.
we might start with you. We were talking before we got started just about how crazy this industry is in terms of lots of people from many different backgrounds and walks of life. What were you doing in a previous life before you found yourself to be the product manager at a cannabis clinic?
So my previous life was agency side marketing, and I guess sort of what I was looking for at the time was a little bit more experience in an industry with a bit more regulation. And I'm sure Andrew, you're across it, but I found
absolutely. I mean, marketing is effectively no regulation, or at least a lot of the marketing people that I meet. I'm sort of the fun police when they throw their ideas at me, but
also socially.
I agree with that.
Yeah, so I guess I worked a little bit from the agency side with Grove Health, and then once I was looking to move on and I was looking for somewhere with a bit more regulation, it just made sense to make that jump.
Yeah, nice. And did you find that because certainly a difficulty in our industry, but a lot of rules around advertising of medicinal cannabis products and services, did you find that when you were on that agency side that you saw that at the coalface, all the different briefs that would be given to you to say, you can't say this, you can't say that? Was there a bit of that?
Definitely. And there was a lot of back and forward on working out, what was appropriate and what wasn't.
Yeah, no, totally. Where, I think as an industry, people know more about that now than they did, say, 3 years ago or I think it was late 2019 when the TGA first put out advertising guidance for people in the medicinal cannabis industry, but still a little way to go. I want to know, so in your current role as product manager, what does that sort of entail?
Yeah, so I think it's generally informing the process and trying to hear from our patients and prospective patients what they're looking for and I guess what their pain points might be in the process and how to make everything just as easy for people that are already struggling and not introducing, I guess, any extra hurdles in the process to them receiving the care they need.
Yeah.
It is. I mean, it is one of those industries that is still emerging out of the stigma of yesteryear, if that makes sense. There's a lot of people that are, finding it difficult to come to the grips with they can actually access this thing after, the last 100 years. It's been very difficult, let's say.
But even when they can access it, it's just, sorry to jump in there, Mitch. It's like it's not like your doctor just says, right, I think you need this, and they write the script. When we're talking about authorized prescribers, they have to go and do separate accreditation and all those sorts of things. You have to submit to the TGA to have that doctor approved. Or if you're going under the special access scheme, it's on a per patient basis and you submit your patient approval application to the TGA. So it's still, even when somebody has that light bulb moment where they go, oh, I can actually get this legally, there's still barriers there, which aren't there for other medicines.
What are patients looking for though on your end? What are you guys seeing on the coalface?
Yeah, I think I guess a big part of it is, these huge questionnaires that people have to do where, they have to submit all of their identification information, their last 4 pay slips to, just be able to get in with a doctor. And I think
it depends on the clinic though, because there are some clinics that just say, do you like cannabis? And if you tick prescription.
You sorry to jump in there, but you see, you can't do that as per the TGA marketing guideline. We will be breaching those guidelines very boldly. So no, we can't do that.
So how many questions are on your questionnaire?
I mean, I'd have to go back and check to get you the necessary information. But I think a core part is just sort of, allowing people the access to healthcare. So getting people, with minimal admin in the door to have the conversation with the doctor and the nurse and work out if it's appropriate for them.
Yeah. So are you saying that you're like the patients that you speak to would prefer to forego, filling out these arduous, let's say, forms at the start with all this information, and would prefer to just speak to somebody, really, is what you're kind of saying?
Yeah, to get in the door a bit more quickly, and they have a lot of questions, and I guess some of what we were talking about before with the regulation can make it difficult to, outside the context of an appointment with a healthcare practitioner, to be able to get them that information. So the only way to get the answers that they are looking for is to get them in the door and get them speaking to a nurse or a doctor.
I guess there's a bit of a tension as well with some of the clinics that I've spoken to, where there's a lot of information that a cannabis patient needs to hear about, so many factors, including, if they're prescribed THC, what the impact would be to their driving, whether or not they need to disclose this prescription to their employer. There's a lot of questions that patients have. And I know that with some clinics, they will say, right, I'm just going to give you, the bare minimum and, minimize that contact with the doctor to say, here's your medical, based on everything that I've asked you about your particular circumstances, here's your prescription. And away you go. And hey, while you're at it, you should read these resources to learn more about cannabis and driving and your obligations as a patient. But then there are other clinics that, really see the importance of the doctor conveying all of that information to the patient at the consultation, which of course, time is money, as we know, and doctors are already feeling it. Do you guys have a view on that at all?
I mean, I guess it's a little bit of both, maybe what you were speaking to. I mean, I know, maybe I'll let Dolly speak to it a little bit, but I know that our doctors will always have the driving conversation with patients just to make sure that that's really clear. Of course, that's going to have a huge impact in someone's life. But I think the other thing that, allows us to work with people a little bit is people aren't always going to walk in the door knowing all of the questions that they're going to need answers to or want answers to. So something that we do is, in addition to follow-up doctor's appointments, we also allow people access to pharmacists and nurses to have ongoing care calls. So if they have a question, they could book in for a chat and just ask that question without having to wait 3 weeks or book in for another doctor's appointment. Yeah,
absolutely.
Do you think, because there obviously has been a huge rise in telehealth, but do you think, are the patients split on what they prefer, or some people, I imagine, would just there would be some people, I imagine, that would like to just fill out a form and get on with it, but then obviously other people that would like to speak to a real person. It's kind of, some people just want their access and some people want, guidance through the whole process. Do you have any kind of thoughts on what the split might be that you see come through the door?
I defer to you to that one, Dolly.
Oh yeah. So yes, we do get, especially with Grove Health. We've started this, and patients do feel that kind of a trust issue is still there. They do feel that they want to talk to the nurse practitioners and get that information, whether it's a telehealth consultation or video. But yeah, that's true. I would say 70% of the patients do want to really speak with the real human and then get their script done, etc. Whereas 30% of those, they don't really care. They just want the script done. That's it.
Yeah, I think that's especially if it's something that, as cannabis is, generally speaking, a chronic condition. I mean, anybody who's getting regular, let's say, cholesterol medicine, for example, after the first few times, like, just give me this. I just need my repeat stock. Like, let's go. You know what I mean?
Yeah. We do get a lot of patients who have gone to other clinics. They had bad experience with them, and they know what they were on. They already got the referral, so they send all the documents to us, and they just want their scripts done. That's it. But the process at our clinic is, regardless of how many consults or scripts they had in any other clinics, we still want them to be consulted by our doctors, nurse practitioners, to decide that patient is going to fit the criteria for the medicinal marijuana, and then we will prescribe those medicine. Obviously, we need to do the CESB applications and all those appropriate approvals.
Yeah. So what is it? What is a typical experience? Can you actually walk us through the patient journey a little bit? Somebody comes to, let's say, the website, they fill in a very short form, let's say.
It says, do you like cannabis? Actually,
no.
I don't know if you've seen it, but that's what it says.
How does it work?
Yeah, well, I mean, I think that's it, right? They come in, they fill out their details, not that question.
Yeah.
And then they're able to sort of self-select a time that works well for them. I think a big part of it is, especially when you're talking about people with chronic health conditions, there's a lot going on. So helping them out as much as we can with the systems that we've built, be able to send people reminder text messages and just all of that standard stuff, so that people know when their appointment is, they feel comfortable about what's happening. And I guess it's easy for them to follow through and get the care they need. So after that booking, then they've got their booking with a nurse practitioner, which they'll attend. And they'll go through the history, a little bit of an assessment. If the nurse sort of deems it appropriate, then they'll get the referral to their doctor and get booked in for that.
So you use nurse practitioner separately to a doctor for prescribing?
Mm-hmm. Yep.
Oh, that's interesting. That's
I know not many other, I would say none of the other clinics are doing it. They just do one consult and that's it, and even 2 minutes. But our consults are very thorough with doctors and nurse practitioners, and then we prescribe. So we're pretty strict. We're following the TGA guidelines very closely always.
What's the purpose of having a nurse practitioner feed into a doctor?
Helping basically be preparing the file for the doctor and getting everything ready. So there's a document prepared by our medical director that helps the doctors to really fast track their consultation. It's like, when you go to a GP, the nurse will take your obs, will get your file ready, everything ready for the doctor, so that when you go and see the doctor, the consultation is faster. Doctor knows why you're actually there.
Mm-hmm.
Yeah, but isn't that usually from a nurse to a doctor, and the nurse practitioner actually has the capability to write that script in the first place?
In July, I know they can if the nurses are in Victoria, and the scripts are being dispensed in Victoria. In July last year, there were some rules came out, and nurse practitioners could no longer prescribe medicines as they were.
Okay. Yeah. Well,
I know it's one of those areas that I think, if I recall, it's all of the state and territory poisons related legislation determines prescribing practices or powers for nurse practitioners. So very interesting. And roughly, just from a patient point of view, once they fill in the questionnaire, do you find that they're speaking to the nurse practitioner and then the doctor pretty quickly after that? Have you had a lot of demand for the services? Like, what's the current wait time for a patient?
So, I mean, we try and staff around that to be able to give people the appointments they want as much as possible. I think generally what we're finding is that people want to either book in the same day or the day after. So obviously there is demand and those slots get filled up, but as much as possible, we try and allow some extra capacity sort of around those times. I think the other thing I just wanted to touch back quickly with the nurses, what we were talking about with people having a lot of questions. And I think there's also a lot of anxiety of, is this a treatment that's going to be right for me, or is it a treatment that, I can even really be thinking about? And I think something that having that nurse practitioner appointment lets us do is they can do that that initial appointment. It can be bulk billed, which lets them sort of come in, ask the questions they have, and work out if it's appropriate for them or not, without having to front $120 or $80 or whatever the cost is to be able to just get some of those simple questions answered by a medical professional.
So the consult is bulk billed prior to the actual cannabis consult. Is that what you're saying?
Yeah.
Right. That's interesting.
Yeah.
That's a novel approach. I think that from what I understood, you could only be bulk billed in person if you had seen that doctor
The
in
rules
person.
are different for nurse practitioners. So the MBS guideline is different. So it has the claims that we do for nurse practitioners consultations are called minor phone consults. And for that, you don't need to see don't need to do face-to-face consultation to be able to do Medicare claims. But you can't do that with GPs. You have to see a GP at least once in 12 months to be able to claim those to Medicare. So we're not doing that for GPs, but we can for nurse practitioners.
Oh, so that would probably save people a bit of money, I'd imagine, in that process.
So our clinic fees are pretty reasonable as well. We do have a lot of discounts for the elderly patients, kids under 16, also healthcare card holders, pensioners, etc. as well. So the prescriber consultation fee is only for those categories $49, and for other patients is $79.
Yeah, that's quite affordable. That's great. Actually, I was just interested, just something you were touching on before about, I think you raised it, Mitch, around the split of, who are the patients that are experienced cannabis users that don't maybe require as much triage and hand-holding versus the rest. I've been sort of hearing more and more about this idea people have that, there's so many recreational users that are accessing cannabis through the medical framework. But I think there's still key to remember that, a lot of people who are accessing cannabis illegally on the black market are doing so because they just can't afford, they actually can't afford their medicine. So they might be growing their own plants or something like this. I mean, do you guys have a view about any of that?
I mean, yeah, we can't stop them what they're doing. Obviously, we're not cops, we're professional people. And, the formulation, I think the last time also I spoke about this formulation of, getting it, so formulation of what patients get from clinics is completely different than what they get from the black market. If they are only using it for recreational purposes, obviously, it serves the purpose. But if you want to use for medical purposes, it's not going to give them the same sort of benefits that they would get from the, real medicinal marijuana products that doctors are going to prescribe, because formulation is completely different. Yeah.
It is. Well, I was going to ask actually, when you touched on that, do you find that from your clinic, because people talk about how there's now probably, of the legal prescriptions in Australia, there's something like 50% of them at a minimum would be for dried flower products. Are you still working predominantly with oil formulations, or do you work with flower as well? What would be, I guess, a breakdown for your clinic?
But a bit of both, obviously. So again, it comes down to the doctors consulting with the patient and what they think would best suit the patient as per their condition. But yeah, we do have, like you said earlier, that we do get a lot of patients asking for flower products. but obviously, you know, we don't just prescribe what patients are asking for. Then otherwise, you know, we're not medicinal marijuana clinics, right? We're just a warehouse selling marijuana.
Which I'm sure there's people that like that. But on the flip side, is there would
and
be,
we won't disclose the address of details.
I was aware. I imagine that though it would be somewhat of a consultative process where the doctor, for people who are more experienced, let's say, with taking cannabis products, I do know that there are doctors out there that have they don't just do what the patient wants, but they do have a consultative process where they say, is this working for you? Do you need to switch to a different type of product? Do you not like that particular strain, or do you want to try something like this? Does that occur, do you think?
Yeah, it does come, obviously doctors do start from low dose, mostly CBD oil, but those patients who have been, especially veterans, if those patients have been on flower, you don't want to switch to something else straight away, because, they are going through already too much, and then changing into their medications without discussing with them and them without agreeing with them, I guess it's not going to work in anyone's favor. So yes, we do get a lot, only after having consultation with the patient, when patient is saying that, no, it's not working, I'm getting, it's not working at all. Can you give me something different, or maybe something higher dose? So yes, it does.
Yeah, interesting. Well, I'm just curious as well, just you guys being based up in Sydney, I think New South Wales, and this is not just me throwing mud across the border from Victoria, but I think New South Wales has been a little bit, I guess, less, I don't know, I wouldn't necessarily describe other states as cannabis-friendly jurisdictions, but the regulations in New South Wales can, from a glance, seem quite strict. I mean, for your patients, I guess, Schedule 8 permits, is that still a thing up in New South Wales, that doctors need a separate state-based Schedule 8 permit, or is that's all?
Approval? Yes, it is still a thing. Yep.
Okay. Yeah, and I mean, I know that the
Queensland is the easiest. I think the rules in Queensland are so easy.
Yeah, well, all the politicians up there have been taking cannabis for years. So
I would say 60% of our patients are from, 60% of our patients, I would say more.
Yeah, exactly. And that's, so it's just really interesting. I know that, people that I know in the industry who have sought to get even a license to supply cannabis from New South Wales, setting up one of these fancy warehouses of the kind that you guys would be all too familiar with. They've had any number of challenges, because the New South Wales Department of Health basically requires you to submit, no fewer than 1,900 separate documents and forms, and it's just like, what the hell is going on up in New South Wales? There's so many barriers.
It's more prohibitive than the other states. I mean, Victoria is pretty green light, so to speak.
It is. I was just as, I guess, as a, people involved in a business up there, how do you guys find it? Are you thinking about relocating to Victoria or Queensland, or are you staying put in New South Wales for now?
We're happy here.
Yeah, staying put. I mean, I guess one of the interesting things is more on the patient side, and some of the proposed legislation that I guess is coming out of Victoria is really interesting in terms of the driving reforms. I'm not sure if you have heard much about that, but I've just haven't had a chance to dive into it properly, but it's it's looking like a positive change. So hopefully.
Is that up in New South Wales?
No, that's Victoria.
Victoria. Yes. No, we are keeping abreast of that, but I know that there's a former magistrate up in New South Wales. I should actually maybe try and get him on the podcast, David Halpern, who's been leading the Drive Change campaign. I think, it's pretty crazy. I know that, but then, conversely, there was recently why have I blanked on the name of that festival that was on in early May, Mitch, up in Nimbin? Mardi Gras, is it?
Mardi Gras, yeah.
Yeah.
Mardi Gras.
but New South Wales Police stopping every single vehicle going in and out of that particular event. So, I mean, it's strict everywhere, but I certainly would love to see the New South Wales Department of Health and the police up there just relax a little bit. So, but yeah. So, and what's next for you guys? So, for the next kind of 12 months, are you just growing the clinic? Have you got more and more doctors onboarding to work with you guys?
Yeah, that's it. I mean, I think so sort of speaking to what we were a little bit earlier about removing some of the pain points and making the process as simple as possible and as intuitive for the patients going through it. I can't speak to it too much, but we've got some exciting things coming. So I think that's sort of what we're doing. I guess one part of it is we want to make it as easy as possible and have an innovative process, but we also need to make sure we're looking after the patients that we've already got in our care and making sure we deliver them a process that's good for them.
Yeah, great. Excellent. Mitch, any last questions from yourself before we let these two get back to their Monday night?
No, we'll just book Dolly in for the third one in a few months, I reckon.
No, I feel like Dolly will just gate crash the next one. That's her vibe. I feel it. It's great. We're all about it. I know. All right. Well, thank you guys. Really, really appreciate it. Yeah, love the work that you guys are doing. And anything to remove pain points for patients obviously resonates with us, but also more broadly our AltMed audience. So thanks for taking the time to come on and talk to us about all that.
Thank you.
Thank you.
Excellent.
Thanks, guys.
All right. When we're next up in Sydney, we'll pay a visit.
Yeah, sounds good.
Sounds like a plan.
Let's catch up.
All right. Take care, guys. Have a good one.
Thank you.
See ya.
Bye-bye.
It's Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we have way more content coming out. And you got to stay up to date with it.
It was good until you did that.
Okay. Sorry.